This is the story of Benheim v. Saint Germain, and it went all the way to the Supreme Court of Canada. Mark Emond was a fit 44-year-old man, healthy, who never smoked. He went to his family doctor for an annual exam. For some reason, the doctor requested a chest x-ray. Remember, current guidelines don't recommend x-rays in asymptomatic young healthy patients. Maybe they did in November 2005. I didn't check. The x-ray actually showed a 1.5 to 2 centimeter ill-defined mass. The radiologist suggested comparing it with past files and 4-month control x-ray or scan. I thought the report was whether wishy-washy 2 centimeter mass of unknown etiology. Scan it ASAP. Dr. Benheim ended up doing a 4-month control. Nothing changed. Mass was still there, stable. Now the radiologist suggests a further 4-month control. No suggestion of scan this time. The family doc asks for it, but it never gets done. He sees the patient again over a year later for another annual. Another chest x-ray. This time the mass is definitely bigger. This time a scan gets done. The patient has stage 4 lung cancer. He dies about 2 months later. So who's Saint Germain again? It's the girlfriend who sued for negligence, having led to Mr. Emond's death. Everyone agreed from the get-go that the family doctor was negligent. The trial judge, the appeals court, the Supreme Court, the college. This was not debated. I already find it interesting because he did in a way follow the radiologist's recommendations. I agree that the family doctor should have tried to obtain the patient's previous x-ray. They were normal. However, my takeaway from this is a bigger mass than 1 centimeter that you didn't know was there should have been scanned right away. In 2022, x-rays have been completely overshadowed as diagnostic tools by CT scans. I still get occasional x-ray reports from radiologists asking for 4 to 6 month controls of abnormal x-rays. This seems legally speaking rather risky. We should be getting to the bottom of what the abnormality is if it's not clear. So why did this go to the Supreme Court if everyone agreed that the doctor was negligent? Well, proving that the negligence caused harm is where things got complicated. As previously stated, x-rays are often trash when characterizing lung lesions, much less staging cancers. The doctor said that the cancer was probably stage 3 or 4 at the earliest x-ray, and the plaintiff argued it was probably at an earlier stage. Usually the burden of proof is on the plaintiff. The patient or their representative must prove causality. Unfortunately, we'll never know because the doctor's negligence prevented the evidence from existing in the first place, i.e., the scan that should have been done. There is a legal precedent for this, an adverse inference of causation, or as I call it, a burden switcheroo, can be invoked to switch the burden of proof onto the defendant because his negligence led to the proof not existing. The initial judge didn't invoke it. The appeals court thought it should have been invoked. The Supreme Court concluded that invoking it is discretionary on the trial judge's assessment, who decided not to. So the burden of proof stayed with the defendant, who couldn't prove causality, shielding the doctor from higher punitive damages. He still had to pay damages for negligence and the anguish and suffering it did cause. So there you have it. You've learned about the legal notion of burden switcheroo. Please don't cite me. On the medical side, I've learned to be more careful with incoming radiology reports. Just because the radiologist is wrong doesn't mean you can't get sued. And finally, a requisite disclaimer: this is not medical or legal advice. Please see your doctor or lawyer for those.